Hello brains! Besides medication, therapy is the most recommended treatment for ADHD, and they're often used in combination because, as it turns out, pills don't teach skills. So today I'm answering some questions about therapy so you know what to look for in a therapist and what to expect. Edward and I are huge believers in therapy. We've both done individual therapy to learn how to work with our brains, and now we do couples therapy to figure out how to work with each other's brains. So we pulled from our personal experience and consulted with our research consultant Patrick, a future psychologist who's currently interning at Duke, to answer a bunch of your questions about therapy. Ready? Let's do it. Can therapy help ADHD? Yes, but the type of therapy matters. The kind of talk therapy where you go every week to talk about your life can be helpful for emotional support, especially if you're going through a life transition like a divorce or job loss. But according to Patrick, there's no evidence that that kind of therapy is helpful for treating ADHD specifically. Luckily, most therapists are trained in several different types of therapy. What types of therapy are helpful for ADHD? The main type of therapy that's recommended for ADHD is cognitive behavioral therapy, or CBT. CBT focuses on how your thoughts affect your emotions and behaviors and gives you tools to help manage them. Closely related to that are dialectical behavioral therapy, or DBT, which can help with emotional dysregulation, and mindfulness, which is the ability to notice your thoughts and feelings without reacting to them. This is all for adults, by the way. For kids, it's a bit different. Because their brains aren't developed enough for CBT yet, it's actually more effective for the parents to go learn special skills to help them help their ADHD kids. This is called behavioral therapy, and skills training, like social skills, time management, and planning, can be helpful for all ages. What's the difference between a therapist and a psychologist? The term therapist actually refers to many different types of mental health professionals that can provide therapy. I've linked to a full list of the types of mental health professionals in the description below. There are so many, I'm seriously considering writing a song about it just so I can remember them all. But the main difference, at least in the US, is that most therapists have a master's degree, while a psychologist, who can also provide therapy, has a doctorate and experience with research in addition to their clinical work. Does it matter? According to research, no. What does matter is your relationship with them. So look for a therapist who uses evidence-based treatments for ADHD that you also click with, not the one with the fanciest degree. Probably do want to make sure they have a degree though. I should not be providing therapy. Hashtag not a therapist. What does it mean if my therapist says they specialize in ADHD? Not a whole lot necessarily. That could actually mean anything from I went to a seminar about ADHD to I've worked with lots of ADHD clients and done extensive ADHD research. So the best way to find out is just to ask. What makes you specialized in ADHD? What can I get out of therapy that I haven't already figured out myself? I know when you've learned and tried everything, it can feel pointless to try something else. But even therapists go to therapy because this is what a good therapist can provide. Perspective and solutions from outside your own brain that are still tailored to it. That's something no amount of lived experience or self-help books or YouTube videos or even a doctorate in psychology can provide. How does therapy work? There's a lot more to it than this, but basically, you come to therapy with something you're struggling with, and this is the important part, want to work on. And your therapist guides you through that process, which is a lot easier than doing it alone. They'll take into consideration what you've already tried, what you know works for you, what you know doesn't work for you, and help you see where your current tools or assumptions maybe aren't helpful for you, and then help you adjust them. A lot of the time, change is hard because your brain is used to traveling down the same neural pathways. Therapy can help you think differently, create new ones, and then practice using them. Is it normal to get a different diagnosis from a different therapist? Yeah, this can happen for a lot of reasons. ADHD shares some symptoms with other conditions. Most people with ADHD have at least one other condition that might be more immediately recognizable. Not all mental health professionals understand ADHD, and there are even different scales and tests to evaluate ADHD. It's not as cut and dried as, say, peeing on a stick. It's really about the number of symptoms and the level of impairment, and that can be subjective. If your therapist doesn't agree with your diagnosis, it doesn't necessarily mean that they won't be a good therapist for you. Unlike a psychiatrist, who tends to focus on reducing ADHD symptoms through the use of medication, a therapist usually focuses on alleviating ADHD-related impairments. And those impairments are going to look a lot different from one person with ADHD to another. So a therapist's focus isn't really on your diagnosis, it's on you as a person and what's getting in your way. So if you feel like your therapist gets you and the CBT they're doing for your anxiety or depression is working for you, that can still be a good fit. Edward's last therapist didn't think he had ADHD, but he had a great relationship with her, and the tools that she gave him were still very effective. So how do I know if I'm with the right therapist? You can be with the best therapist in the world, and it won't matter if it's not the right therapist for you. Ideally, you'll look forward to your appointments, usually leave feeling optimistic most of the time, and while therapy itself can be uncomfortable, feel comfortable enough with them that you can be honest about what you're going through. That said, if your therapist starts to feel more like a best friend you can vent to than a professional guiding you, it might be time to move on. If you get too comfortable, you can start to plateau. It's kind of a Goldilocks situation. So, the right therapist is one that you feel comfortable enough to be honest with, who is also helping you grow. How many sessions till I know if it's working? The first session is what's called an intake, which is just getting to know each other. For the therapist, it's a time to gather information about you and what brought you to therapy so that they can create a plan to help you accomplish your goals. At this point, you should feel heard and validated and able to ask any questions that you have. After a couple of sessions, you'll probably have a sense of whether or not you'll click and have decided on a plan of action. But you're still getting to know each other. 2 or 3 sessions in is usually when the real work begins. And according to Patrick, having a strong therapeutic alliance or relationship by the 3rd or 4th session is a good indicator of future success. Of course, especially with ADHD, progress isn't always linear. Because we can't pause life while we go to therapy, a lot of things can set us back. And as we change, we don't always necessarily remember how bad things used to be. So if you're ever concerned you're not making progress, it's a good idea to check in. Your therapist might have tracked major progress you didn't even notice, or realize it's time to push you a little harder. How do I find a therapist? If you haven't yet, check out our video on how to find a therapist right here. In the meantime, you can find peer-to-peer support on our forums at forums.howtoadhd.com. Thank you to my brain advocates and all my Patreon brains for making it possible for me to learn and share this stuff with anyone who needs it. And another big thanks to the Patreon brains who jumped on voice chat and Discord with me last week to help me decide what questions to answer and what information to include. You all are the reason I'm not currently an anxiety puddle trying to tackle a topic this important. Like, subscribe, click all the things, and I will see you right now in that other video. Go watch it. Bye, brains.